Good evening once again. This is Dr. Bimbala Onifade. I'll be talking today on this is day 2 of our free dietary program, and I'll be talking on these topics: introduction, misconceptions, healthy meal idea, and I'll also be talking to you about our services at the end, by which we can help you better. And so our focus for today's meeting is on dietary guide. And I want to talk about some misconceptions. So in talking about misconception now, there are about 5 misconceptions I want to clear. The first one is talking about wheat, that wheat is better. But as we go on in today's meeting, you get to understand that there is something called glycemic index, and that talks about how your blood sugar goes up, to what extent it goes up, which depends on what you eat. Now, wheat, you can eat it as swallow, and they also do wheat bread as well. If you compare it with something like the white bread even has lower glycemic index. That means when you eat the white bread, it will not increase your blood sugar as much as that wheat will do. So it simply means that that concept is totally wrong. Compare wheat swallow with a bar as well. Your blood sugar is going to go up more. Now, that doesn't mean it is bad to eat wheat, but I'm just saying that wheat is not a treatment or a cure, or maybe a better food for diabetes, as people will put it, so that when people get diabetes, they now feel like, okay, the food I'll now eat as swallow is wheat, and what I eat as breakfast is wheat bread. So if that's what you are doing, thinking you have just changed the type of your food that might increase your blood sugar, you have not really done anything to help whatever the situation at hand was at that time. Another misconception is that what you should be eating now is protein. So when you're talking about protein, you talk about beans, you talk about, mainly when people say protein, if you ask people, okay, what's protein? The next thing most people will tell you is that's beans now. So, and that's not particularly correct. That's not correct. The carbohydrate content in beans is more than the protein content. So the beans is generally called protein because it contains more protein than most other foods. It doesn't mean that beans is entirely protein. So the carbohydrate content, if you put it over 100%, beans has more than 50% of carbohydrates than whatever protein. So most of the food that exists naturally, most of those foods are carbohydrates, and rightly so, because carbohydrate is what actually gives energy. Now, it doesn't mean that protein doesn't give energy, because everything you eat is still going to be converted to glucose at the end of the day. But the long and short is that you need carbohydrates. People we talk about different things. Sometimes talk about, that food, does it have cholesterol? I don't want cholesterol. Then what's cholesterol? Your body cannot function without cholesterol. In fact, the lipid layer of your body, if you want to put percentage to it, is huge. And your body needs that to continue functioning. So you discover that there is a lot of misconception about all of these things. So it's only protein you should eat. Then that food will increase your cholesterol. Doesn't mean that there is no food that can do that, but it's probably not one single food that will just do that at one single time. So it's a combined effect, and that's what I want to introduce you to this evening. I can't actually cover everything this evening, and that's why I'm going to be talking to you about our services at the end, which includes a dietary program. I don't know that I've ever seen that look in the eyes of good number 4. I don't know what all the just yet, but trepidation, no doubt. Okay, so sorry, there was a little transition. I just switched to my phone audio. So I guess for some minutes you cannot hear me, but I've taken care of that now. So please, did you hear what I talked about when I was talking about protein? Did you hear me then?
Yes, sir.
Yes, sir.
Okay. All right, thank you. So now the last one,
Sorry.
the last misconception we want to take care of is talking about carbohydrate is the problem. So I said
Yes,
most
sir.
of the food, almost all the food that we eat contain, not almost, yeah, let me say almost all contains carbohydrate, not just contain. Almost all food are contain. So we discovered that most of the food we eat contains carbohydrates. So sometimes, I'm sorry, the carbohydrates are in two forms. I don't know if you hear that. The simple one and the complex one. So the problem is not carbohydrate. The problem is what kind of carbohydrates are you consuming? So you want to convert your carbohydrate load to a complex carbohydrate, not just simple carbohydrate, or most of your carbohydrate load to that. Yes, I know that I'm speaking quite a number of terms that might get some people confused and say, what is this and what is that? So we're going to break it down as we go on, and as we go on tonight, and as we progress in the program as well. So the next misconception is that you are fine once you are taking drugs. So this misconception, most of the time, well, I don't know where I should say we get it most from. Now, there are two things about drugs. One of the main reasons for this program is that we want to help people to live a normal life, like a normal blood sugar, a normal blood pressure, even without taking drugs. Every people will now come and ask different questions. Say, have I destroyed diabetes or hypertension? That's not my own point. And that's not what I'm after. If everything in your body is normal, it is normal. So the question now of if you have overcome, not overcome, I don't know what to answer regarding that. If after you have been able to deal with this, as we're going to guide you, you are off your medications and your blood sugar is normal. As a matter of fact, I'm not going to be saying that you should stop your blood pressure medication or blood sugar medication and immediately. That's what most people do. I mean, individuals, they do that by themselves, and that's very dangerous, you know. But at the same time, you are not fine just because you are taking drugs. Now, take diabetes, for instance. If you start diabetes now, your doctor will give you a kind of drug. You are taking the drug, you discover it's controlling the blood sugar. Later on, before you know it, it's no more controlling the blood sugar very well. Then there is need to add another drug. Then maybe for some time it's working. Then there is need to add another drug. The thing about diabetes, for instance, which applies to hypertension too, is that the more drugs you are taking the more drug you are taking, the more it shows as it is progressing. And what we are just trying to do in hospital is to force it back. But even the definition of diabetes states that it's a progressive disease. That's peculiar to diabetes. It's a progressive disease. So if it is a progressive disease, then what can help you to bring it back is what is important. Then now let me say that if you have diabetes, if diabetes is getting worse, you discover that you're already getting a setup for hypertension. That's why you discover most people who have diabetes also have hypertension, or they eventually become hypertensive. So whatsoever applies usually apply to the two, because the underlying problem, if you have been reading my lecture and listening to the video, is actually insulin insensitivity, which causes inflammation, which happens in hypertension as well. So you need to get that. So even for both diabetes, for hypertension, you discover that over time, the dosage of the drug you are taking is not really getting things done well. Now, for diabetes, there is a test to do that check how well your blood sugar was controlled over 3 months. For hypertension, there is no test like that. So your blood test for diabetes might be normal this morning. Next tomorrow, it doesn't mean it was normal throughout. So it's within 3 months itself that you can know maybe what has happened over 3 months is effective or not. So assuming 3 months of coverage is not well effective, it simply means damage is still going on within the organ in the body. So what you want to do is whatever will reverse it. Medication is good because it prevents damage on the short term. But what's your long-term plan? The long-term plan is to be able to deal with the root. As you are dealing with the root, and as you are dealing with the root, and as you are improving, you will need less medication until you don't need it again. And when those who we deal with as our clients, I'm talking about within 3 months. Some people less than 3 months, definitely. So that's why I say within 3 months. Most people. Of course, some other people require a little longer time. So I can't say for individual until we know what is peculiar to you. So, and the last misconception is that diabetes and hypertension is for life. And that's what we are dealing with here. It's not for life. By that, I mean high blood sugar or high blood pressure, saying it is for life. Your blood sugar or blood pressure doesn't have to be high for life. You don't have to be taking medication for life to bring it to normal. And how to do it, that's what we are starting in this free program. Then those who need more help will join our special services so that we can help further. But now, my focus tonight is I want to talk about if you have diabetes or hypertension. Now, let's talk about healthy meal. The benefit of living a healthy life, eating healthy meal is your medication will not need to be increasing rapidly. So even if you will have to continue your medication, your blood sugar or blood pressure will be balanced, and that can go on for many years. The only thing that will remain is maybe the medication might have side effects, and then maybe the damage might continue little by little, but it is not as rapid as it is going to be without that. So you should understand this. Then the second thing I must say is that we have to approach to dealing with diabetes and hypertension and to helping people to reverse it so that they don't need medication again. They continue to need the lesser medication until they are entirely off medication. What we are going to be dealing with tonight cannot capture that. What we are going to be dealing with tonight is only going to capture the fact that you discover that if you do what I'm telling you tonight, you begin to recover within your body. You might still need to be taking medication in this scope. So this is just talking about a healthy meal. This is more preventive. Then if you already have it again, it's going to prevent rapid progression. Then the third thing that is possible is to reverse it. In terms of reversing diabetes, it's not what I can come and do this evening because it takes time. So it is what we deal with clients over time. So I want you to understand that. So with this understanding, I think we can progress into dealing with the diet aspect. So it's good to get a feedback. Let me know, can you hear me? Can type, you can unmute your mic and speak.
I can hear you, sir.
All
Yes,
right.
I can hear you. I can hear you, sir.
All right, good. All right, good. Thank you. Thank you. So I want to talk about Hello. Sorry, I just discovered that I lost you again. Sorry. So
Welcome back, sir.
Thank you. I want to talk about glycemic index, glycemic load, and second meal effect. So the glycemic index, like I've been talking about, is the degree to which your blood sugar goes up or not based on what you eat. So glycemic load is derived from glycemic index. It means that some food might not spike your blood sugar up as such, but if you are still taking too much of that food, in fact, it will be better to even hit the one that will spike it up much, but you're not eating too much. But why not eat moderate food? And when I mean moderate food, I'm not talking about just a bowl of food. Moderate simply means you eat to your satisfaction, but the kind of food you eat determines the moderation. If you eat good food that have good glycemic index, you're going to be satisfied. And this food is available for all classes of food that you normally eat in Nigeria, the type. And we're going to be talking about that. Then the second meal effect, I won't really be going into that now. This talks about some of the things that you first of all eat that impact the next thing that you eat and help in the control and doesn't make the next thing you are eating to go. Second meal effect is like a way of making glycemic index even better, much more better. So the food is already good in glycemic index, but the first thing you have eaten in that day now impact on the next thing you are eating. The next thing you are eating also impact on the next thing. We not talk much about that because it takes more professionalism. What I mean by that is this is one of the concepts we use for our program. So in terms of dietary guide, meal plan, sometimes it might be more peculiar to individual, but just understand that there is something like that as well. So having said all of this, then this glycemic index, glycemic load, second meal effect, all of this combined together is actually one of the main bedrock. Yes, there is still other factors in the bedrock of our program, but this is a big bedrock, and many times we might need to tailor it to individual as well. So it's good for you to have this knowledge. If you know a way of going about it to getting things done for yourself, why not? But when you understand this concept, you're able to have more confidence that the people you are dealing with, like I'm pitching to you now, talking about people that will come for our program to join. You know that, okay, there are so many. It's not just about, okay, what food should I be eating? It's not just about that. It's about the science behind all of these things that makes it capable to reverse diabetes and make it capable to keep your blood sugar or blood pressure. To reverse diabetes and hypertension and keep both blood sugar and blood pressure normal afterwards. So I know this is the part everybody's waiting for. Okay. Let's go into it now. Yes. We now want to give practical examples. So don't be discouraged about the kind of foods you are going to be seeing. This is just an example. You don't have to eat it. And you don't have to eat it the way they put it in their bowl, like this. And if you can eat it like that, why not? I'm just trying to give you practical dietary examples. So, I talk about complex carbohydrates. If you look at this bowl, you'll see this. This is vegetable. This is broccoli and rice. This is avocado as well. So this is a combination of grain and vegetable. The advantage of this kind of food is that, number one, you can see the broccoli. There is a lot of significance of this food. This avocado you are seeing, avocado is one of the best things you can eat, especially if you have issue with high blood cholesterol. So it contains what we call omega-3 fatty acid. And what omega-3 fatty acid does is it helps in lowering the cholesterol that we call bad cholesterol. Not like it's actually bad, but that's what is implicated in peripheral artery in arterial disease, that causes clotting and causes problem like chest pain, angina, and all of what you are trying to avoid. So that's an example. That's an example of food that you can eat. And for broccoli too is very good for your heart too. Now, what I want to talk about in terms of what I need to point out is, people think that, okay, I'll go and buy this, I'll now be eating it, so it just cure my disease. That's not what I'm talking about. You remember, I've said before that all of these things combined together is actually what gives the result. It's not just eating broccoli and say, I'll finish heart problem. You might even finish yourself in some other stuff doing that. So, but the simple rule is moderation. Everything in moderation. Why not? If you want to eat it as meal, maybe you are taking a good size and eating it as meal. Why not? But don't think that just by eating broccoli, then diabetes or hypertension will go away. I see a lot of stuff like that. Everything that makes diabetes or hypertension, that makes you not require medication and the rest again, is not just one isolated thing as it is presented. It's not just one isolated thing. It's combination of what you eat, what you don't eat is also part of it. Exercise is all of these things working together. There's no one single food you eat and after you are eating it. Yes, there are some leaves that works as medicine, but I don't even know of any of such in Nigeria. But even those leaves doesn't, number one, they are expensive leaves because of their health benefits. And number two, it's just a kind of medicine that has not been prepared, in short. So the ancient leaf, for instance, works good as well for diabetes. So now you see this again. This is another kind of a healthy meal. You can see, so another thing you should notice in this meal is that you can see how everything is green. Yes. So let your food be green at least once a day. So it simply means you're getting vegetable in the food when it is green. See this again. It is both green. Is this yellow, white? So combinations. So that's what I'm saying. And it is combination and continuation. Let me put it that way. You can't just say you have combined in the morning, the next meal you are eating junk again. Or maybe the next day you are eating junk. Combination, let's take it as combination and continuation. It's good to have feedback. So I can, one or two or three people say combination and continuation, maybe to stick it to our mind like that. You can meet your mind and say combination and continuation.
Combination and continuation.
Good. Good. So any other person wants to say combination and continuation?
Combination and
continuation.
Good.
Combination and continuation.
That's excellent. It's combination. Right.
Continuation.
Right. So combination and continuation, that's essential. All of this stuff, we are limited by time. I can't say one by one, okay, this one contains this one contains that. But of course, in our premium program, we're going to go into some more details. So, but let me talk about that broccoli that I'm talking about the other time. So it contains some vitamins A, C, K, fiber, thiamine, niacin, so many. So the importance of these things is that, especially vegetable, there is something we call micronutrients. And micronutrients are small, but those nutrients, they repair body. Let me put it that way. Our body is under constant work. Our body is working constantly. Our body is working constantly So there is need for continuous repair. How do you think it gets repaired? It's on the micronutrients, like all this vegetable and everything. Still, one micronutrient does not do everything. Everything contains, everything have different way it works. It's just like one drug cannot do everything. You know, there are adverts like that people be advertising supplement or one drug and they say it will cure this, it will cure that. But you know, it's not true. Many people here would have bought such supplements, but it doesn't work as they claim. So I'm trying to give another example. You can see this. At least most of us will be able to relate with this. So this is pomo, and this is cucumber. We also have lettuce. This is tomato. You see vegetable as well. So it is that combination that I talk about. Now, one important of tomato is a very great antioxidant, and it helps in fighting several diseases. I mean, eating tomato like this, you see the way they slice it, it's very healthy to eat tomato like that. It improves the heart. It has effect on the heart. It also helps in preventing cancer. Maybe you are from a family that there is so much history of cancer. It's good to include tomato in your food. That doesn't mean you are eating only tomato, because somehow for us in Africa, tomato is not the best, the greatest. We don't have taste for tomato. We are not trained. That our taste bud is not trained for that. But sometimes you don't just eat only. See this food that is in front of us. If you are eating a meme like this, why can't you hit tomato? You can hit it. And after your tomato, eat your meme, it will clear away the taste if you don't like the tomato taste. So, can see how this plate looks. This plate is white, is yellow, is green. So all of these other things contain good fiber. It fills you. The momo too is good, but this combination is going to really help. Your blood sugar will not just spike anyhow. So this is rice. So this is rice. You can see this combination again. Really, it's not like there is anything you cannot eat forever. Now, when people come on our program, sometimes for peculiar reason or for general reasons, there are some food we replace with another kind, like this white rice, we likely replace it with something like brown rice or fada rice or basmati rice. Sometimes, but it doesn't mean that that is what they are going to be eating for the rest of their life. Then number two, if your plate looks like this, your blood sugar will, except for some other problem or maybe the duration for which you have had it or some other concentrations. But you know that this is still going to be better than somebody that is not hitting this kind. So you discover that you are hitting healthy like this, you are doing exercise as well. Then your blood sugar is going to be better controlled. So you can see how this plate looks, see tomato, but that doesn't mean you carry this number of tomato and just eat like that. Then your egg, I said here that egg is not bad. The importance of egg is that it boosts your HDL cholesterol. So we call it high density lipoprotein, but leave out the formula and not the special terminology. The main thing is that this egg contains what boosts it. So, but we're having this conception that we should not eat egg, it will kill. Where did we get all of that from? So we said that it contains cholesterol. Yes, it contains cholesterol. Cholesterol is not bad. So, and when people's cholesterol go up, one of the things we want to do in the hospital is that we want to ensure that HDL, that's high density lipoprotein. So the level of that high density HDL, when it goes up, is good when it is in certain range. So you want to boost it up. This might help. So many other things might help as well. I'm not trying to exhaust everything. In our premium program, that's the program you pay for. They have a special program, like a free program, so to say, for those who join, that deals with cholesterol, how to bring your blood cholesterol down, or how to prevent high blood cholesterol. So I'm not trying to exhaust everything, but this is still a tip that is not a bad idea if you incorporate. So egg is not bad, but that doesn't mean you should eat too much of egg. In fact, let me tell you, there are some studies that shows that eating up to 4 eggs a day is okay, and it helps in cholesterol, HDL cholesterol. So I don't know, maybe it is economy that make us believe so much that egg must not be eaten because at least you save some money. But it's not compulsory if you don't want to. So this is yam. I really don't think you should hit this number of yam. Few slices, egg sauce, okay. This is opara rice and this is vegetable as well. Then this is couscous or quinoa, both looks like this. So you can see, if you don't know it, don't worry. You can see this is rice, this is tomato, this is broccoli. So when you hit this, especially when you hit this one, quinoa, or maybe it's couscous, you are going to have rich micronutrient supply to your body. So now I put this here so that you know that I'm not trying to say that our own swallow is bad. This is wheat, this is starch, this is fufu, this is eba, this is amala, this is oatmeal. So, but if you want to eat it in moderation. Remember, this is just a general tip also. We have the way we plan it and the one we emphasize and we put forward in our special program. But this is general. You don't even have to have the abilities to follow this tip that I'm giving. Everybody should eat healthy like this. And it's going to impact. You will need less medication. Because remember that the problem that is one of the main major reasons causing this problem deals with the diet. But what we want to do is that we want to take drug so that it will deal with the matter. But what is causing it, we don't want to address it at all. Then our society, we are already adjusted, not just in Nigeria, even outside the country. We are already adjusted to some, because food is sweet, we enjoy it. So there are some bad way of eating we have adjusted to that we don't want to make it normal. So, and if you see all the things I've been showing, food doesn't have to be boring. You don't have to suffer for what you are eating. You understand? The only thing is that it must be the right food. And you will get a better result than the people that are cutting down the size of the wrong food. You will get a perfect result, at least that keeps you healthy and is not making all the disease to progress rapidly than the one that is not doing that kind of a thing. So this is just an advice. Stock up on staple ingredients to make food shopping less frequent and a lot cheaper too. So you can see all this, nothing much to say. Okay, let's say something about this. This is chicken. This is the breast. See, this is apple. Then all of these are healthy, but I want to emphasize on this chicken. So white meat is good. Red meat is not terrible to eat, but white meat is good. Then this is breakfast idea. Yes, your pap, you can take it, but this is oatmeal, and this is berry that is cut into the oatmeal. So coca oat is very nice. It's a good breakfast idea. And so you have to plan for what you eat. The secret sauce of healthier food choices is in meal planning. So you have to plan ahead. So the more you plan, the better. You're going to be eating healthier than people that doesn't plan. So having said all of this, I talk about glycemic index, glycemic load, and second meal effect for the beginning. I'm bringing it up again because this is a general idea. And when I say general, I hope you will incorporate it, even if it is just the idea, even if it is not those exact food that I put forward. You know, we have one idea, one terminology that we use this evening: combination and continuation. So you want to have a good combination and have a good continuation. That is the most important thing you should take out of this program this evening. You understand? So now I want to talk about our services. But let me first of all talk about this again: glycemic index, glycemic load, and second meal effect. Then there are other maybe 4 or 5 principles apart from this one that I mentioned. Why am I saying that? We have a dietary program, then we have a diabetes and hypertension intervention program. What is the difference? In diabetes and hypertension intervention program, you will also get the dietary program. But for the dietary program, it is just the dietary program. And it is like a do-it-yourself kind of a program. So the program is what you can continue to follow, but we advise that you at least make sure you follow it for 3 months, even if you want to just continue using the concept of the program and not particularly following it. But it is also flexible. They're also flexible. So the purpose of the dietary program also will help you to reverse the problem. But if you're on medication, if you want to lose weight or you have concern not losing weight, you get what I mean? There are 2 concerns: you want to lose weight or you don't want to. Then diabetes and hypertension intervention program is important. Even if you want to lose weight and you are not diabetic or hypertensive, the program will also help you. Understand that not everybody wants to lose weight. So that's why I say if you want to lose weight or you don't want to. The dietary program is like a do-it-yourself, but this diabetes and hypertension program, like I'm doing this kind of a call once in a while, even after the program ends. Those who are my clients, we have some people that are clients for up to 5 years now. They still join a call like this. So what I'll be discussing with those people is different from this one now. For those ones, I want to listen to how they have improved, what's their issue. So I give them special, you still want to continue helping them. So that's the difference. But for the dietary program, when you pay for it, just go and get it done yourself. There are videos that are involved. There are also PDF, meal plan, dietary guide. Is an elaborate program. And if you come on diabetes and hypertension intervention program, that is also in the program, the dietary program. So for now, I'm going to talk about it more tomorrow, because tomorrow I want to specifically focus on telling you how to reverse diabetes and hypertension. If you have made it today, make sure you are here tomorrow. I'm not coming to advertise that you must pay me money tomorrow. I just want to conclude the program to tell you how to do it, because it is not just by diet, but tomorrow you will understand what is involved. But to just get your mind ready that you should join this program, and yours sincerely, diabetes and hypertension intervention program is a good one for you to join. But you're going to get more information about that. You can also go to www.smartmedicalprograms.com/premium. It's very bold, written on the net, to go there and say, we are on promo now for the diabetes and hypertension intervention program. So, but tomorrow, I'm going to talk more about that. You can go to, maybe you're watching this video in the future, you can go to www.smartmedicalprograms.com/premium, and you'll get more information on how to enroll for the program. So tonight, I don't want to mention any price particularly on this now. So thank you for taking out your time to be part of tonight's program. I'm really encouraged for the number of people that have joined. And I will open the floor now for question and answer before we call it a day. Thank you.
Good evening, doctor.
Good evening. Please let me mute everybody first, then you unmute again, because somebody is talking. Okay, let me see if you can unmute. Okay, now go ahead, please. Good evening.
Good evening, doctor.
Please, you can just tell us your first name if you don't want to tell us your full name, and tell us where you are calling from, where you are talking from.
All right, sir. I'm Peace by name, calling from Warri.
All right, ma. Thank you.
Sir, please, the food that you talked about, the broccoli.
Yes.
Can cabbage be a substitute to broccoli?
Well, it's not particularly substitute or not. The only thing is that cabbage is also. Do you understand?
Yes, sir.
Anything green is good. Then let me tell you, anything that does not grow up, that just grow on the floor, they are also good.
Okay, sir.
When it comes to vegetable, but cabbage is good. I understand that the broccoli might not be easy to find in some places. You
Yes, sir.
readily will get it in places like More and the rest. So, like you mentioned, substitutes now, where we can really talk about substitutes is on our special program. And why I said that is that we have varieties that is beyond. You see the number of things we just select here. In that we talk about a lot of stuff, and we all even plan it out. Do you understand? So there you will see a lot of substitutes. Yeah.
Okay, sir. Okay, sir. Thank you, sir.
You're welcome. So any question again, please? Question or comment?
Oh, hello, doctor.
Hello, ma'am. Good evening, ma'am.
Yeah, good evening. I really appreciate your teaching. The question is not really based on today's teaching. It's just a normal thing I do hear from people. Like,
It's okay. You can go ahead.
just a question. Do breastfeeding increase high blood pressure?
No, it does not.
Okay.
It doesn't. Except you are getting stressed up because you are breastfeeding. No, that's different thing. Except the breastfeeding is giving you problem. That's a different thing. But other than that, just normal breastfeeding, it doesn't increase high blood pressure. In fact, I would even think it should even make it slower. I'm just saying that don't take it as a medical advice.
So that make it what?
No, that's what I said. Just forget the last thing I said. It doesn't increase high blood pressure. No. Yeah. Thank you, ma'am. Any other question or any other person with question, please? So is it that people understand what I said too much or they don't understand? Please ask question or or give a comment. Then we have about 5 minutes more to leave. Please.
Doctor,
Yes.
I don't know if anybody wants to ask more questions. Something I want to ask is is not from what you just taught us now. I don't know if I should proceed. Say one,
Please,
please.
your first name and where you are talking from. Or you've done that before?
I based in Lagos.
Okay, thank you.
So, you know that I told you that after yesterday, I told you after my delivery, I start having hypertension, which to the extent I have to they refer me to a physician that is managing it. You know that when I started the woman, she prescribed like a drug. I will be using drug morning, afternoon, and night. That's how then I will take morning drug. I will still take afternoon, 8 hours. I will take night.
Yes.
So, and I will be meeting her every month. And
That's likely Aldomet, right?
Sir?
Is that Aldomet?
No, not this Aldomet is there, is among it. This Lebatano is there too.
Okay. All right,
and
continue.
I don't know if I pronounce it well, nefidipine.
Okay.
So morning, afternoon, night. At a point, okay, every month I will go and see him. So she advised me to buy a BP machine so that we'll be checking it at least morning and night. And I have been doing that. So at a point, I stopped taking afternoon own because, doctor, to swallow drug every time, morning, afternoon, that thing is not easy. I
Okay.
stopped afternoon own. I only take morning and night, though I did not tell her about it. I
Okay.
still check my BP. Sometimes we see 102 over 75, 78. That's the down one. So at a point, I stopped night one too. She's not away. I don't know why I'm going this length. I don't know if I'm making a wrong choice, if I'm going a wrong direction,
Okay.
so that I can
Thank
go
you.
back.
Yes, thank you for the question you asked.
Um,
So maybe
I
tomorrow we'll talk about our special program. So these are the kind of question I'll be able to answer on that kind of a program, not on this one, because this is just a general program for everyone. And medically speaking, it is again medical ethics to be giving a personal medical advice just on a general note. So the person, either you want to consult the person for free or the person is paying you, it must not be just general advice. Do you understand? Because there are many other questions I need to ask you. There are many other information I need to have. So I can't just say this is what you should do or not. I think you get what I'm talking about.
yes, doctor.
Yes, but that opportunity will be there tomorrow. You understand? For those who come on our special program. So I'll be able to evaluate your issue and be able to give you the proper guidance.
Okay.
All right. Yeah. So I think it's a good time to call it a day. If possible, I just would like to take one more question, especially if it is different from what people have been asking, because it also serves as an opportunity for people to learn. Otherwise, it's a good place to call it a day today. Nonetheless, we need feedback. Please, apart from question, if you don't have question, you can give us a feedback on today's program. Yes, there were hitch here and there. The feedback I'm talking about is how valuable is this information to you. So, one or two persons before I call it a day.
Doctor,
Yes.
thank you very much. I appreciate what I saw today, and
Okay.
I learned a lot. I'm very grateful. Thank you, Franca from Abuja.
Oh, that's great. You're welcome.
Thank you.
You're welcome.
Thank you very much, Doctor. Though I joined in late, but I obviously enjoy every bit of the lectures
Right.
and hope that tomorrow we'll have more of it too, that we'll be able
Yes.
to continue and our slogan. Thank you very much, Doctor.
All right. Thank you. All right. Yeah. So one last thing, please, for those who are here, especially those who have spoken, and those, let me even say, especially those who have not said anything, I'll appreciate if you can leave a comment on the group. Let people know how much this has helped you. So you'll be helping them, you also be helping us. So helping them in the sense that they'll come on this, they are blessed, they hear information, they know what to do. Because everything we have talked about today, we had more life, medically speaking, to whoever observed it. Then that's how they benefit. We also benefit because, number one, we're able to touch more people. Number two, the more people are able to get exposed to this, the more people that can come on our special program that they pay for. And it is when people pay that we can continue this kind of the one that we do for free. So just this Zoom meeting alone, it costs money because you have to pay for Zoom interface, design, many other stuff like that. Then also we are also a business, so we like making money also. So I'm saying that because if you leave this information on the group, many more people will come, they get helped, and that helps us out. So thank you. Please help us leave a comment on the group tonight about how much this program was helpful, and So we'll meet tomorrow again, same time. I'll post the information on the group. Have a good night, everybody. Enjoy yourself and put everything that we have said into practice. So it is
Thank
not
you, sir.
people here that are
Thank
blessed.
you, doctor. All right. Good night.
Good night. Like the Bible says, it's not those who hear that are blessed, but those who do. So let's
Good night, sir.
Thank you.
So doctor, tomorrow, the same time, right?
Thank you very much.
Yes, the same time, but
The
I will
grace
put
of God, sir.
information on the group.
All right.
Okay.
Oh,
Bye-bye.
All right.
Good night.
Good night.
Thank you so much. God bless.
Amen.
Thank you so much, doctor.
God
Thank you
bless
for
you, sir.
God bless.
Thank you.
Thank you. Good night.
It's so kind.
oh, Robert.